of foxglove. Beautiful, beautiful plant. Big velvety leaves, long stalk up the center with those sort of bell-shaped flowers coming off of it, said to attract fairies into your garden. And what we're going to do right now is dive in a little bit to this wonderful plant, digitalis purpurea, and consider the importance of some of its compounds, what makes it such a good heart medicine. So from a TCM, traditional Chinese medicine perspective, foxglove promotes blood circulation, right? It's going to start moving the blood. It's going to tonify the heart. From the Western standpoint, we're looking at some of the scientific research that goes behind it, and that brings us to the cardiac glycosides. So just what are they? Cardioglycosides, they're a class of drug, and they help treat heart conditions by pumping up the heart rate, moving the heart rate, forcing the contractions to be stronger, raising blood pressure. So, in the movies, this is like the kind of go-to place, right, in emergency rooms. The cardioglycosides that can be found in foxglove, digitoxin, digitalis, dioxin, right? There's a group of them collectively that are found in this plant. And as you can imagine, the pharmaceutical drug digitalis is from the foxglove plant. Classic example of a pharmaceutical drug being derived from plant medicine. And it is the go-to drug in emergency rooms when you are having ventricular fibrillation in emergency situations. And that's that classic flatline scene in the movies. They're like, raise the heart rate, get it up, get it moving again. And this shows how powerful the plant medicine is. And obviously the pharmaceutical drug is an even greater concentration of it. Using foxglove as a medicinal herb, generally it's going to take like 12 hours for its effect on the heart to be kind of appreciated. And it's used for upping the blood pressure, regulating heart rate. It's also a very powerful diuretic. Makes it very useful for treating edema, especially when it's associated with heart disease. So those are two common conditions, the chest pain or the dropping of blood pressure, the raising of blood pressure, and edema. Now, just to be clear here, beta blockers are a different class of drugs. So you've got your cardioglycosides. They're the class that's going to up the heart rate, increase the force of the contractions of the heart. So it's just working more. So it's tonifying it, right? That's the TCM perspective, tonifying that heart, making it stronger, more effective. Beta blockers kind of have the opposite. They're going to lower blood pressure. They slow the heart rate down, reduce sweating and trembling. So they actually are often used not just for heart disease, but even anxiety, even migraines, for example. And another class to kind of be aware of, not class, but, group of drugs is your calcium channel blockers. They operate by reducing the strength of the heart muscle contraction. So it's contracting, but not quite as, not overdone. And they work by relaxing blood vessels, reducing the pressure on the heart that way. So you can see how in verbiage, they help the heart. They help with heart disease. But these are different. This is why your diagnosis is important. Cardioglycosides, raising the blood pressure. Beta blockers, lowering it. And your calcium blockers coming in to kind of soothe it out, relax those blood vessels, take the edge off. So foxglove is a cardioglycoside, and it's full of them, and it's even where the Western pharmaceutical medicines come from. Go visit us at whiterabbitinstituteofhealing.com and find out more about this extraordinary healing plant, foxglove. And just as a kind of fun fact, yellow foxglove, it's not really used medicinally because there's different varieties of foxglove. It's your woolly foxglove that's got about 3 times the amount of cardioglycosides as the other varieties. It doesn't mean the others aren't going to also have these same properties. They contain similar compounds. But there you're going to get an even more forceful one. It's another reason why you want to be sensitive about what part of a plant you're using, that you've got the right botanical name, and that you're dealing with the right, even harvesting time can make a difference in terms of compounds. But there's just a little tip about foxglove for you.